The whole point of everything we're doing is to make sure we don't overwhelm the healthcare system.
It started with just a few infections, but in a matter of weeks, it grew into a global pandemic.
You know, Iowans are scared and they're nervous, and I appreciate that, but we're going to get through it.
And Nebraska was on the forefront, with top doctors and nurses at the helm, treating patients from Wuhan, China, and cases from cruise lines.
I wouldn't think twice about bringing them back to our nation. I wouldn't think twice about providing them world-class care.
Tonight, how far we've come in the last 5 years.
The vaccine, when it came out, was truly almost a godsend.
To the impact on restaurants and small businesses.
I didn't believe that we could be shut down, and sure enough, obviously we were.
From teachers modifying how to get students to socialize.
It upended our idea of school.
To the need for mental health care coming out of months in lockdown.
Right now, we're in the stage of lessons learned.
This is a KETV Newswatch 7 special report. COVID-19, life after the pandemic.
Good evening and thanks for joining us. You know, the COVID-19 pandemic was one for the history books. We're still talking about it 5 years later.
It took countless lives and impacted those who came out on the other side in ways we still don't understand.
Tonight, we're taking a look at those impacts and how our society has changed in the last 5 years.
You might remember the pandemic was at the forefront of minds at Nebraska Medicine and the University of Nebraska Medical Center. With one of the nation's few biocontainment units and top doctors and nurses, it made the decision on where to send Americans in the epicenter of Wuhan, China, or on a cruise ship easy. I sat down with several doctors, nurses, and experts to talk about those early days and how they handled dealing with a virus nobody knew much about. To understand where we're going, we have to understand where we've been.
And Americans possibly exposed to coronavirus in China are now on their way to Nebraska.
The word tonight from authorities, there is no threat to the general public.
February 2020, Americans infected with a new virus on board a cruise ship near Japan.
Another American positive for coronavirus coming to Omaha.
UNMC says the patient was evacuated from the Diamond Princess cruise ship.
A new coronavirus that was transmissible from person to person and caused severe respiratory infections was always high on people's radar as the potential source of the next pandemic.
Dr. James Lawler is the Deputy Director of Nebraska Medicine's Biocontainment Unit and a UNMC Professor of Infectious Diseases. To call him a COVID-19 expert might be an understatement, and for Lawler, it was only a matter of time.
Pretty early in the course of events, again, by the end of the first week and into the second week of January, when we started communicating the fact that this was a very dangerous situation and that this could easily evolve into a large pandemic.
He flew across the ocean to assess patients on board the Diamond Princess.
If the Diamond Princess had been a country at the time, it would have been the country with the second largest number of COVID cases documented in the world after China. So our original mission, as we were tasked and as we saw it, was to go onto the ship, assess the general situation, what was the level of risk, what were the hazards, what could we learn about COVID and this emerging event from the experience of the shipboard population, and then to assess the American citizens who were on board, who wanted to come back.
American citizens like Bob Thorburn and his wife.
It was very, very confusing, for one thing. I have to hand it to Princess. They tried to do the best they could with what they had. But like everybody on that ship, up to the captain and including the captain, nobody knew what to do.
15 passengers turned patients. First, a plane ride over the Pacific. Dr. Michael Wadman was one of the physicians in full hazmat-style suits to greet the passengers.
13 of the 15 that displayed signs and symptoms, so we transitioned to isolation care from quarantine and kept them in the quarantine unit, provide isolation care, ongoing testing, and this is before we knew much about COVID.
It's the premier biocontainment quarantine unit in the country. What was it like to be there?
For me, it was very traumatic. It caused me anxiety because I could not get up and walk out. I could not even leave the room. But they were very good. They were very, very good. I cannot say enough good things about the treatment we got in Omaha.
None of the Americans from that cruise died, all eventually going home.
we definitely did not want COVID to enter the community through our isolation activities, and that did not happen. I think that really demonstrates that our unit, our personnel, our policies, procedures, the facility itself is very well suited for providing safe care.
But this was only the beginning. We would soon learn a new term: community spread.
Mayor Gene Stothert calls this a rapidly changing situation that requires action, flexibility, and accurate information.
I was watching a briefing and I was next to Dr. James Lawler, and it was the first case of documented community spread in the United States on the West Coast. And I heard him say under his breath, "Well, here we go."
Dr. Daniel Johnson is a critical care anesthesiologist at Nebraska Medicine, one of many on the front lines of the pandemic.
The initial surge of patients came from one of two backgrounds, almost exclusively. These were nursing home residents who had contracted COVID-19, elderly patients, frail patients, and meat processing workers from all over the eastern part of Nebraska and western Iowa.
On March 5th, 2020, Omaha's first patient walked into the emergency department at Nebraska Methodist Women's Hospital. But access to a COVID test wasn't easy.
You had to call the state, and my sales pitch was, she's got a headache, but she's low sats, her chest x-ray looks like COVID, and she traveled from England. So there was a delay, and then eventually the infectious disease doctor was able to get us a COVID test.
Emma Hutchinson was in her 30s. This team didn't know if she'd live or die.
Each time I was just, "Emma, it's okay, I got you. I don't know what's gonna happen." And I told her that, but in this moment, I got you. I will figure it out.
Emma was transferred to Nebraska Medicine, put into a medically induced coma, and woke up weeks later. KETV talked with her months after.
It's really sad that people have died from this virus, and I'm the lucky one.
She was the first of thousands. By May, Katie Willett's emergency department was full.
One of the first ones I saw of someone who walked in with an oxygen level in about the 20s, which, we like to be above 90. We start getting worried when it's below 80. Normally, we don't see people alive in that number.
Doctors, nurses, hospital staff, everyone had to change. Everything had to change. Masking, PPE, daily testing, visitor restrictions, and video calls.
People were afraid. We were working with the biopreparedness team on donning, doffing, getting, what are the things we need with our physicians? How do we set up our rooms? How far can you open a door? Just multiple things like that. And things were changing minute by minute.
The fear of the unknown.
My experience at that point was the people I saw were horribly ill, and kind of in your head, the thing you're thinking is, I hope that they still have an ICU bed for me if I get sick while I'm working here.
There were days and there were shifts that, we lost patients in the double digits of my unit that had 24 beds. And so turning over your unit with like half of your patients was hard. Sorry.
Doctors and nurses turned community heroes.
And at the end of the day, we're there to help people who are sick, and this was no different. And I think a lot of people rose to that challenge and, just did what they could to take care of people that needed it.
But at the end of 2020, a medical breakthrough.
There's never been a question in my mind, and there's not a question in the mind of any real vaccine experts, that the vaccines are safe, they are highly effective, and again, they saved millions of American lives, and they saved tens of millions of lives worldwide. One of the most amazing scientific contributions that the U.S. has made to the world.
The pandemic wasn't declared over until May 2023, 3 years after the initial wave of cases. Douglas County Health still maintains its COVID-19 dashboard. Nearly 1,500 dead in the last 5 years, but the lethal rate's staggeringly different by age. 5 in every 100,000 if you're 19 or younger, 5 in every 100 for 85 plus.
If anybody had said this virus is going to cause over 1 million people in the United States to die from the disease, I think everyone would have agreed that's a horrible prospect. That occurred.
Still ahead, missteps and lessons learned. Medical experts double down on the COVID vaccine and offer a grim look at if we're ready for another pandemic.
One of the good things is that our memories are short, right? We get over hurdles and we go on to the next thing. One of the bad things is that memory is short and we don't recognize some of the lessons that perhaps should have been learned and are setting ourselves up for, unfortunately, failure as we go forward.
And later, the state's largest school system and how it's changed its methods since 2020.
We're not anywhere where we need to be, but we're moving in the right direction.